Well, it is time for our visit with Dr. Kevin Kavanagh. He is a retired physician and founder of a national organization called Health Watch USA. Good morning, Doc.
Good morning, Jack.
This morning, got a couple things to talk about after the CDC recommendation isolation period. Apparently, it ain't working.
Well, yes, there's been several studies which show that a substantial number of people, between 25 to 33%, are still infectious after day 5. And that's somewhat discouraging. I strongly feel the CDC should be recommending getting a negative rapid test, even 2 negative rapid tests, before releasing someone back into the public. I think that's imperative. And England has more stringent requirements. I think, again, with Omicron, we need to be stepping up our preventive strategies instead of backing them down.
Okay, and there's some disinformation, imagine that, spreading regarding vaccine effectiveness. Tell us about that.
Well, that's correct, and that has to do with these studies, and I think we saw that with one of your previous guests, that relate that, well, these vaccines are not working well preventing infections after approximately 1 to 3 months. You start getting increased infections. In fact, after 90 days, there's very little vaccine effectiveness. But the key word here is infections. That means asymptomatic infections, symptomatic, etc. They do appear to be very effective in preventing severe disease, in preventing hospitalizations and deaths. From what I am told, and this is just from doctors, also if you look on the literature or you look at the news media, over 80% of the current hospitalizations are in the unvaccinated. And we have well over 50% of the adults fully vaccinated in the United States. And over 90% of the ICU admissions are in the unvaccinated. So hospitalizations over 80%, ICU admissions over 90%, all in the unvaccinated. And so we really do need to get vaccinated in order to get control of this pandemic.
I keep reading that we are nearing, if not past, the peak of Omicron. And then I read that Moderna and Pfizer expect to have a vaccine available for Omicron in March. Is this too little, too late?
It is, except if you consider that we're probably going to get variants which are based on Omicron or based on Delta in the future. And Omicron is especially problematic. And so I think the idea here is you get a new vaccine, you broaden your immunological response, and get yourself ready for the next strain. And the next strain, most people are thinking, is going to be based on Omicron, so it will make your immunity better. Omicron has almost fully escaped the vaccine, and the key word there is almost. Still get the vaccine. But the next variant may well fully escape it. And so the idea of getting a new version of the vaccine out, I think, is a very good one. Remember, we originally thought this would happen every year. Now it looks like it's happening after 2 years. So that's not unexpected.
What else do we need to know this morning, Doctor?
Well, I think looking at what's happening in other countries so that we can make sure that we have in our mindset this is a virus, a pandemic, it's not something political. Other countries are enacting further stringent requirements, such as requiring vaccination into public venues. France has just enacted that. But I should note in France, that was passed by the legislature. It was not a presidential mandate. They're now requiring vaccinations to get into public venues, and that even includes those people that have a negative test. They now still have to be vaccinated. So I think other countries are looking at this. They're saying we're in some trouble here with Omicron. The trouble is increase in hospitalizations. And as we talked about before, as what happened with me with having my cancer surgery canceled, is that if vaccinations are not taking place, hospitals are going to fill, and then people with other diseases, other treatable diseases that need to get care may not be able to get that care. So please go out and get vaccinated.
Dr. Kevin Kavanagh, thank you so much.
Thank you, Jack.